My name is Shawn Nason. I am CEO and founder of MOFi, formerly known as Nason Group. When we talk about putting the consumer at the middle, it's more than just putting them. In today's world, we as consumers there's been this terminology over the last 4 years called liquid expectations or fluid expectations, that experiences from industry to industry to industry are the same for us. And we've had the honor and privilege over the last 18 months to lead an initiative within Walmart and their healthcare organization around a whole concept where we have built, and those of you that are from the States, where we've actually built a model led with the patient at the very middle and built the business model behind it. So patient first, customer first, and then put the business model behind it. 150 million people walk through a Walmart door into their store a week. 90% of America lives within 10 miles of a Walmart. And so when we started this initiative within particularly the health and wellness area, the focus was we knew that consumers were not happy at all with the experience in the healthcare system. And so what Walmart has tackled, and with our partnership with Happy or Not in this, is to start providing, again, particularly for clinicians, real-time feedback, real-time data. No real significance, no real data in NPS. So we challenged, and let me say this, because I'm a third-party vendor, Walmart does measure their NPS in their retail space. But I said in the healthcare space, when I worked with the CEO there, Shawn Nason, I said we can't measure NPS anymore. We have to really start measuring real-time data. And again, why we implemented Happy or Not. It's not about a number. It's not about meeting a number. It's about getting real-time human interactions, because the pendulum is swinging in the industry, particularly in healthcare. The pendulum is swinging that people want human interactions again and don't want tech. Flew here yesterday from Las Vegas. Any of you at the Consumer Electronics Show this week? There's still trying to find this balance between technology, even in retail and every industry. How do you use technology? How do you do this? I am thrilled with what Happy or Not brings to us, because it's technology, but giving us real human interactions, because many of our industries, retail, all industries, it can take 30 to 60 days to get a consumer feedback survey done. But this way we can get it day, real time. So that's how we're implementing it. We're new to the journey on it in Walmart, but I've done it with other partners. And it's where we really bring the human interaction piece back in. We have another organization that we're working with, Quest Diagnostics, where what we did is our team's an experience design firm, so we journey mapped the whole experience of the customer through their PSCs, and we actually put Happy or Not at different portions of the journey, so we could start first off finding where the journey was not working well for them. But if we knew at the beginning, if we got a negative experience at check-in or with the phlebotomist, we knew that real time, so those teams could try to come back and do recovery at checkout. And that has been real powerful. We've done it also within an oncology group, which is not always a great, when you're in there getting your infusion, that if your experience has been bad from a nurse or a medical assistant or from check-in, that the director of experience can get to that patient immediately. Don't always know exactly which one it is, but you can start to figure some of that out. But we use it very much as we're fixing the journeys through locations.